India's Union Health Ministry says the number of confirmed cases of COVID-19 has risen to 50. However, a tally from state governments show that 60 people have tested positive. Well, for more on this, we cross to our correspondent in New Delhi, in India, Neha Poonia. Good afternoon, Neha. I wonder if, can you hear me? Okay,
Good afternoon. Yes, I can.
Super. So just tell us what the latest is in terms of the number of cases that are there in India and the contradictions that are coming out as well.
The Indian Health Ministry confirming that there are at last count 52 confirmed cases of COVID-19 in the country, but tallies coming out of state governments show that tally could be at about 60 plus. The way India is conducting most of these tests is that there's initially a preliminary test when someone displays symptoms of COVID-19, following which a federal institute conducts a test as well on their samples, and that's when once that test result is confirmed, the Union Health Ministry puts out a final tally. The Indian Health Ministry is also fielding allegations of not conducting enough tests, and many critics say that there is perhaps a case for under-reporting as well, but many states, for example, like the state of Kerala in South India, which has reported the highest number of cases, is also proactively testing on its own, which is why we're seeing these contradictory figures. But like we've seen in many parts of the world, the build-up of COVID-19 spread has been slow and gradual. It's been the same case in India as well, where just a few weeks ago we had just about 20 confirmed cases, most of them foreigners who had travelled into the country and were quarantined. But now we're seeing that number double or so in the last 2 weeks, and we're given to understand that many more people are currently under observation as well. At last count, 83 individuals have been quarantined in Delhi today as well after arriving at the capital from Milan.
What's the atmosphere like in India? How are people conducting themselves? Is behavior different? Is there more fear and panic?
There's been a marked difference in the last 1 week, I can tell you that for sure. For example, like we've seen in most parts of the world where the coronavirus outbreak first became a national health emergency, we're now seeing most pharmacies, most online retailers run out of face masks, sanitizers and gloves. You have a lot of people who are walking about wearing face masks on public transport, on flights, on buses, in offices as well. Many companies also advising their staff to work from home, though it's not along the scale that we're seeing perhaps in the UK or the United States, but there is significant fear on the ground. Another problem that's perhaps very unique to India is the kind of misinformation we're seeing around concerns of coronavirus and its spread. For example, in the initial days when this wasn't quite a health emergency for India, you had the Indian Health Ministry advocating the use of homeopathy and Ayurvedic or natural medicines for dealing with coronavirus. A lot of people are sharing messages on WhatsApp talking about how drinking hot water can help cure the disease, how homeopathy is a cure as well. So that's a very unique problem that India is dealing with, that many health experts are now trying to dissuade people from believing in.
So earlier when we spoke to Ishan, who's also one of our correspondents there in India, he did indicate that India had clamped down on certain travel restrictions, not letting Italian people come into the country and so on. Has that ban or that principle been extended to other countries? Because we're just learning that in China, some of the coronavirus cases, the new ones that they're having, are actually imported from other countries.
It's a similar story in India as well. A lot of the cases that have been confirmed are actually foreigners, and then we're now hearing of contact transmission as well. A few weeks ago, just about 10 days ago, you had a very limited travel advisory in place, mostly with the Indian government advising Indian citizens to not travel to countries where the COVID outbreak had been reported. But in the last 24 hours, that travel advisory has been revised quite significantly. The Indian government saying that visas, e-visas issued prior to this date to nationals of about 12 countries, most of them European, will no longer be valid. You have people from Spain, Italy, Iran, Saudi Arabia, Dubai, China, many of these countries where you are seeing cases being reported. They will no longer be allowed to enter India. We're also seeing a change in how testing is being done. In the last 24 hours, the Indian government confirming that all international passengers coming into India are being screened. There are significant restrictions imposed on India's land borders as well, and that in some states, even domestic flights are being screened, with the government not wanting to take any chances.
Thanks very much, Neha, for your contribution. That was our colleague Neha Poonia reporting from New Delhi in India.